My name is Kayle Caudill, and I worked with Justin Brown and Sarah Weaver on our PICO project on whether or not CPR was beneficial to the elderly with CHF, which is chronic heart failure.
So our PICO question was, in the geriatric population with end-stage heart failure, what is the effect of receiving resuscitation and or intubation on their quality of life compared to quality of life prior to receiving the resuscitation and the intubation? And we found that this was significant to nursing practice because patient-centered care is of the utmost importance for our profession and providing good quality of life. So if CPR is initiated to a patient with heart failure and after CPR they are in a worse condition than before, then was the purpose of CPR really beneficial to them? And this has been a controversial topic between healthcare practitioners because some feel that the effects of CPR just prolong the natural process of death, and then also the increased or the decreased quality of life is worsened. But patients bring up the controversy of wanting quantity of life over quality of life. And so that is why we decided to research into this topic.
So the theory that we felt worked best along with our question was Kukawa's comfort theory, and it guides the nurse to develop a relationship with a patient in order to decide if receiving CPR or becoming a DNR or DNI is best based on their quality of life measures. So the nurse will formulate a comfort care plan with a goal of enhancing comfort over a measurement of baseline comfort. And whenever the comfort of patients and their families is enhanced, they are engaged more fully in health-seeking behaviors, which are mutually agreed upon goals. Health-seeking behaviors can be internal, external, or peaceful death. When patients and families do better, the institution does better. And the conclusion of our question and the research that we did was that patients who have a DNR order are shown to have a risk of worsening prognosis due to worsening quality of life. The review of literature found that the quality of life was lessened in patients with congestive heart failure who received the CPR. As adverse effects of CPR include anxiety, depression, PTSD, fatigue, diminished quality of life, and additional hospital admittance lengths, injury to the liver and spleen, damage to the airways, internal bleeding, heart contusions, and pulmonary complications.